Thanks everybody for joining us today for CANHR's Town Hall on COVID-19 vaccinations in nursing homes and assisted living facilities. I'm Mike Dark, I'm a staff attorney at CANHR, and I'm also a member of California's Community Vaccine Advisory Committee. And I'm so pleased today to be joined by Dr. Jonathan Evans, who's the former president of the American Medical Directors Association, as well as KJ Page, who's the administrator of Chaparral House, which is sort of our go-to nursing home when we want to show how things can be done right. I'm going to lead off with a short discussion of the vaccine distribution program in California, and then we're going to go to KJ to get sort of a view from the trenches, really from the battlefield. And then Dr. Evans is going to take over to walk us through a discussion of vaccine risks and benefits, but we will be sure to reserve time at the end for questions. If you don't get your question answered at the end, make sure you just email it to us and we'll be sure to respond. You can also ask questions using the chat function, which you'll find at the bottom of your screen. And you can raise your hand to be called on using the participants tab at the bottom of your Zoom screen also. So other than that, the usual Zoom etiquette, of course, applies. Keep yourself on mute unless you're being called on to ask a question. So with that, let's get a quick update on where California's vaccine distribution program stands. And I think for all of us, after such a dark year, it was with a huge breath of relief that we heard that there was these two vaccines that had been approved under the emergency use authorization statute. First, the Pfizer vaccine on December 11th, and then the Moderna vaccine on December 18th. And what you're going to be hearing, I think, from Dr. Evans is that both vaccines are very effective, but the problem from a distribution perspective is that they're still in limited supply. So demand is much greater than supply, still will be probably for a couple months. And so the CDC and California health authorities came up with a scheme to prioritize who should get the vaccines first. And the group that was given the highest priority, designated 1A, originally consisted just of frontline healthcare workers and residents of long-term care facilities, including nursing homes and assisted living facilities. Now, it's important to understand the reason why these groups were prioritized. It was really to ensure, first of all, that healthcare providers who we need to stay well to treat people who are ill get the vaccine so that they don't get sick. But it also takes into account the fact that long-term care residents are among the most vulnerable to the virus. We all know that. And also disproportionately wind up in general acute hospital ICU beds that are in such short supply right now during this surge. So treating them along with the healthcare providers is also a good way of trying to make sure we keep some beds open. But one thing that we've seen happen over the course of the last couple weeks or so is sort of increasing frustration at how slow this rollout of vaccines has been going. And so partly in response to that, the CDC has recommended expanding that 1A group, the high priority group, to include people who are over 65 and people with significant comorbidities, that is other serious illnesses or disabilities. But California has, for now, just added people over 65 to the 1A group at this point. It may be that the Biden administration, which is coming in, it accelerates vaccination even more by doing stadium-style mass vaccinations that's sort of being set up. And so people should stay tuned about whether those priority groups continue to evolve as the pace of vaccination increases. So here's a frustrating thing. Aside from issuing these priority guidelines and coordinating the allocation of vaccines to counties in the state health authorities really have largely left the logistics of getting the vaccine into people's arms to county health departments working together with CVS and Walgreens as partners to deliver the vaccines. That is in most counties, not in LA, for reasons we can talk about later. Facilities have to sign up with one of the pharmacies to set up 3 clinic days that are called for vaccinations to happen. But what's very frustrating is that the state currently offers no public tracking of progress in vaccinating long-term care residents. LA County DPH, which opted out of the partnership program, has a kind of dashboard that you can look at, which tracks progress, although it's not completely up to date. As nearly as we can tell, larger nursing homes and assisted living facilities that are attached to larger nursing homes seem to be getting vaccines, but there's been a huge problem getting vaccines to smaller assisted living facilities. It's something that we at CANHR and others have put on the radar of state public health authorities, and they say they're moving quickly to try to address that problem. If you or a loved one are in a facility that is not offering any vaccination dates, or worse, is telling residents to just figure it out for yourselves, call us, because that's something that we want to communicate to the state. So with that, why don't we turn to KJ for a view of what's going on in real time in the trenches. KJ?
Thank you so much. I'm honored to be here. So Chaparral House had our first vaccination clinic Tuesday of this week. We vaccinated all of our residents but 2. Those 2 residents had consent from their responsible parties. Both of them have advanced dementia and both of them refused the shot. We had our staff going along with the pharmacist who was doing the actual injecting so that the resident had someone they knew to kind of help talk them into it. Both of them had agreed to it when we talked about it because they're conversational, but when it actually came to the needle, they really had no concept of what was going on. So these 2 folks will be offered again on our next vaccination clinic, which is in 28 days, and then on the 3rd vaccination clinic. But we're not going to force them. They said no. The families have an opportunity to come in and physically hold their hand and try to talk them into it on our next clinic. We're going to make arrangements for that to happen. So we figured 2 out of 40 wasn't such a bad thing. Everyone that had capacity or that had some cognitive impairment, but not serious, were able to consent. And those folks that were not able to communicate, their responsible people agreed, and we got them their shot with no trouble. I vaccinated all of my staff. We separated them into 2 groups. We planned 80% of them the first time so that if there were reactions, we'd still have staff to cover. And those folks will be getting it on the 2nd round. So we had a total of 6 staff refuse ahead of time. And on the day of vaccines, we only had 4 staff refusing. Those folks each spoke to the medical director personally. 2 of them agreed to take it and 4 did not. And so we're working with those 4 so that they have an opportunity on our next vaccination clinic to get it. Again, those are not really bad percentages since so many other people are refusing it. And it wasn't anything crazy like nanoparticles or a chip or the government or anything like that. These folks, one of them had severely held religious beliefs that she just didn't think a vaccine was appropriate. So we've encouraged her to talk to her religious counselor and see if that helps. Our medical directors offered to reach out to her religious advisor to see if that will help. The other 2 just have a lot of pre-existing conditions and wanted to make sure their physician signed off on it before they took it. And that's understandable. So we have them an opportunity for the next one. Out of all my staff, some of them had sore arms. I myself didn't. And I had to actually look under the Band-Aid to be sure there actually was a mark because I didn't have any soreness at all. And I'm thinking, well, did they fake that or what? I have a picture to prove it, but I didn't have any soreness. I had 2 staff that are my youngest 2 in the entire facility in their early 20s that had that hit by a bus feeling the next day and a low grade temperature, did not ever get over 100. So they missed 3 days of work, but they're back today and they're feeling better. And it wasn't horrible for anybody else. None of my residents had any complaints beyond mild soreness that a Tylenol took care of. None of them needed more than 1 dose of Tylenol. And so we're considering that a huge victory. They came in from the pharmacy for the clinic. It was a huge assembly line process. They had everything down to the minute, how many syringes they drew up, who was doing what. We had someone stationed to collect the paperwork, check off the box, go into the room, get your vaccine, go out a separate door, stand in line 6 feet apart on the red X's. So it was a lot of staff intensive behind the scenes, but I've got a really great team. And so we all knew our roles. We'd rehearsed it ahead of time. So everybody stepped up and we did it just fine. The residents were kind of laughing, those that were out and about, because there were so many people around and so much going on. It was like chaos central, but everybody knew what they were doing. It was sort of like a turnabout when there's a lot of traffic, but nobody gets crashed. Everyone knew what was going on, and even though it looked crazy, it made sense. So we're very thankful and we're looking forward to the second dose. We've had a lot of inquiries to the Berkeley Public Health. We're under their jurisdiction, and Alameda County, as well as the local CDPH office, about what's next. People that have come for short term and get their first dose here and that are gone before their second dose, where do they get it? So far, there's not been a solid answer, but they're thinking that by the time they're out of here or the third clinic's over in the end of February, that phase 1B or 2 will be enacted, where CVS and Walgreens and other pharmacies, Safeway and Lucky's, whatever, will have the option to give vaccines there. They were referring them to their primary care physicians, and we were doing that. And I got a call from a few local doctors that say, why are you telling people that? We're not going to have the vaccine. We don't have the sub-zero refrigerators, and there's none to be purchased because LA County and other counties that have opted out have purchased every single sub-zero refrigerated device in the area. So that's kind of a non-starter. We also worry about what about new employees and new residents after February? Where are they going to get the vaccine? And again, the answer is we're looking into it. We don't know, but by then we hope that everybody will be able to get it through this next phase. And that's pretty much where we are now. We've been very lucky. We've had we had one positive case early on with residents, and she was asymptomatic, and she's been negative on subsequent tests. And we've had a total now of 4 staff months apart that have had positive results, which then give us our reactive testing. Everyone gets tested for 2 weeks. No one else has gotten it. We've been negative after that. So we've been really blessed. We're spending a lot on PPE, a lot of time on education. We have what we call PPE police on every shift, so that they will say something. These are people that I've asked, would you please say something if you see something? And then let me know so that we can follow up individually with them. What we're not doing is disciplining. We're doing performance improvement. That, hey, we know that you didn't have a mask on, or I heard that your mask was under your nose, whatever. And then if they're repeat performers, then of course it's discipline. But most of my folks get it. They're as scared of the vaccine as anybody else, and they're as scared of the COVID as anybody else. So they want to be vaccinated and they want to keep people safe. So that's pretty much where we are now. We're kind of lucky, and I realize we're special because we're small. Another thing that keeps me special is most of my staff have been here a long time. I have very little turnover because we paid for benefits all this time and a lot of other reasons, but we don't have a lot of turnover. So my staff kind of trust me, and they trust our managers, and we trust each other. So we're pretty much tight knit, and they know the residents really well. We've been person-centered for a while, and people are really kind of defensive of their residents and wanting to make sure that everything's done right for them.
KJ, it's great to hear how smoothly it's going for you guys, even with all the work that you're having to put into it. Can you tell us just quickly what efforts you've made to kind of educate residents about the risks and benefits of the vaccine, or is that something that the pharmacy people do?
Oh no, we did all that. The pharmacy people came in and gave the shot. Now we had a female pharmacist who was very nice and rather personable, which was different than the pharmacist in the room with the staff. They kind of asked the questions. It was kind of, they said it 100 times and it was just kind of robotic. They didn't bring their personalities with them, which was fine. We didn't need them to be personable. They weren't mean or anything, but it was just one after the other. But the woman that came to the bedside, actually, you could see she was smiling under her mask and her face shield and her Tevic suit. She had some nice words to say to residents, and she kind of had that personal touch with her. So no one actually was upset with her. And plus we had staff to go with her. So that was part of it.
Great. Thanks so much, Kate.
We spent a lot of time talking to residents ahead of time. those even with dementia that are part of things, part of life, that understand there's a virus going on. They may ask me 20 minutes later, why do I have a mask on? What's going on? Why there isn't bingo? And so it's a repeat performance if they don't remember. But we send all the information to family members. I communicate with them in writing every week. We do a lot of texting and phone calls and a lot of Skype and outreach. So we feel like we've done a lot of sharing information. If I attend a good webinar that's open to public, I send that link to some of the family members that are really active.
Great. Thanks so much, KJ. Dr. Evans, why don't we get the scoop on the vaccines from you? Do you want to lead with just a general overview first? I think you're muted, Doctor. There you go. Oh, you're muted again. There you go. You're good.
Can you hear me okay?
Yep.
All right. Thank you all very much for joining. I'm Jonathan Evans. I'm a physician. I specialize in geriatric medicine, and I spend most of my time when I'm seeing patients in long-term care and home settings. I also happen to be an epidemiologist, and so that's somebody that studies, pandemics and things like that. And so since the start of COVID in this country, I've been involved from the very first outbreak in this country until now, both in the direct care of patients with COVID, as well as trying to help organizations and stakeholder groups deal with the COVID pandemic and keep people safe. I've had COVID myself as well, and I just received the first dose of the vaccine last Saturday, a week ago. Let me just say, there are 2 vaccines that are currently available. There are several others that are coming down the pike that are in various stages of development, and there are basically 2 kinds of vaccines. The two vaccines that are currently authorized in this country are very similar. They, in a nutshell, they involve a material called messenger RNA or mRNA, which you can think of as just like a little instruction or a blueprint that, in this case, is injected into your muscle. It ends up in the bloodstream. It finds its way into cells, where it sends it gives a message to your cells to make a particular protein. That protein happens to be identical to the protein on the surface of the virus, even though there's no virus or any components of the virus in the vaccine, but it happens to make this identical protein. And what that does is that protein is identified by your immune system as something that doesn't belong, and your body says, hey, this doesn't belong here, let's get rid of it. And so they quickly get rid of it, but also they plan ahead for the next time this sucker shows up, we're really going to be ready. And so it turns on your immune system so that you're ready for an even more vigorous response in the future, so that hopefully you won't be infected at all. And so that's the general concept. The other vaccines that are not yet authorized in this country they're a little bit more traditional in their design, in that they actually involve the use of an actual virus, not the coronavirus, but a different kind of virus that acts as sort of a Trojan horse. And it has a piece of DNA that's another instruction to your body when it gets into your cells to make the same protein so that your body does the same thing. So the end result is identical with all of these vaccines. The strategy in which how it gets in the cells and how the protein is made is a little bit different. The 2 that are out currently are extremely effective, and they're extremely safe as well. And I can say more about that. I will say more about that. But the problems that we're talking about right now are, one, there's not enough of the vaccine. And so people that really desperately need this vaccine aren't getting it. And there's another problem, which maybe isn't talked about as much, but there are a lot of people who are given high priority to get this vaccine, namely healthcare workers, many of whom, in fact, the majority of whom in some states, are not getting the vaccine. So there's a lot of what we'll euphemistically call vaccine hesitancy in this country, where people are reluctant to get vaccines for a variety of reasons, mostly fear. And then there are some people who are against vaccines altogether, and certainly people with strongly held religious beliefs for which vaccination would be contrary to what they believe and how they live. The vaccines are very safe, but I'll talk more specifically about that and issues about who shouldn't get it. So I've been spending a lot of my time in the last couple months trying to encourage people, as you already heard, to get the vaccine, as was described previously. That involves one-on-one conversations, as well as, having lots of conversations like this, where we try to give people who are considering the vaccine an opportunity to be vaccinated. And information is essential. Facts are essential in making a proper decision, but facts alone are generally insufficient to change behavior. And so, and having conversations with people you trust are often an essential component of that as well. And as described earlier, where in a long-term care setting, the federal government set up a program where they contracted with private vendors to come in on 3 separate occasions. What that basically means is that each resident and each employee has 2 chances to get the first dose, and only 2 chances. And then the third clinic is really just cleaning up and giving the second dose to whoever has had it yet. So my personal experience has been a number of staff have been reluctant. They want to see how it goes first. And that's understandable. Let me just say, first of all, when we talk about the people who are frontline workers in long-term care settings, and I've met some incredible and even heroic people who do that work, but in fairness, many of them have never been given the opportunity to be first in line for something good in their whole life. And so naturally, when they're being told, well, there's a vaccine and you get to have it first and no one else has had it, some of them might think that they're being guinea pigs. And they have not been, I mean, who among us hasn't been taken advantage of at some point or another? And so you can understand that a lot of this reluctance comes from lived experience. And so a big part of my concern today and every day is really to help people feel safe and supported and really loved and cared about. I just want to emphasize that I consider these drugs to be a miracle of sorts. I mean, it is our way out of this pandemic, but bear in mind, it is our only way out, and it requires just about everybody to get vaccinated, and it is a race against time, because each day that passes, several thousand Americans die. By this weekend, more Americans will have died of coronavirus than died in World War II. And, somewhere in the neighborhood of 250,000 people out of approximately 3 million people who live in long-term care settings has already died of coronavirus. And again, by the end of the weekend, 1 in 800 Americans overall will have died of coronavirus. So this is an unprecedented tragedy, and it requires, I think all of us can express some disappointment about how we got here and frustration about why things aren't working the way they are. I can't solve all that right now, although I have some opinions, but I just want to make sure that each of you has has an opportunity to ask your specific questions. And if I can't get to all of your questions today, I promise you that others on the call will help me to answer all of your questions in the very near future.
Thanks for that, Dr. Evans. And so let's unpack a little bit some of these issues around what you're calling vaccine hesitancy. And by that, we really just mean people being afraid or unwilling to get the vaccine. One thing we hear frequently is a concern about the speed, the apparent speed.
Yes.
At which these vaccines were given emergency use authorization. Is it your sense, doctor, that any corners were cut in getting these vaccines to people?
The short answer is no, but I should preface my remark or qualify it by saying that I am, by nature and also as a consequence of my training, and I'm very critical of data, and I don't take things at face value. And so I wasn't willing to simply rely on public statements. I insisted on looking at the data directly and doing my own analyses, which not everybody has an opportunity to do, but I have that training. And I was very concerned about the political climate and all sorts of and the politicization of health organizations like the CDC over the last several years. And so, I looked at all of this through a very jaundiced eye, and I'm telling you what I have concluded personally and independently, and also in response to a number of questions, whenever possible, I will give you a reference for you to look at as well, because I don't want you to think that this guy's just spouting off his opinions. This is entirely fact-based. A couple things about the timing. With regard to these messenger RNA vaccines, these kinds of things have been in, the technology for this has been in development for about 13 years. And so it's really not a new technology. It's just that this technology was deployed to develop vaccines, which it hadn't been used for before. But it's so successful that already a number of other vaccines are in development using the same technology, including vaccines against HIV and influenza. And so this is probably going to be the technology of the future for many vaccines, at least in this country, because there's some other considerations, as was mentioned. I mean, the cold storage and so forth is really only possible in, highly industrialized countries, and for many parts of the world, especially Africa, some places where it's hot all the time and they don't have access to this kind of freezing. Some of these vaccines aren't really very useful in that setting.
Thanks for that. And another issue that actually KJ sort of touched upon is side effects. And she clearly had a very good run with side effects.
Yeah.
Some people complain about it more, and some people are very afraid of the side effects. And I think it's worth just noting for a second that, a mild fever or even aches and pains in a 20-year-old may not have exactly the same effects as someone who's 95. And so can you walk us through how significant side effects are and whether people should worry about it?
Absolutely. So let's just talk a little bit for a moment about the whole concept of a side effect. In general, we think about side effects that are some things that generally don't affect most people that take a particular medication or a vaccine, but that might be predictable under certain circumstances. But when we're talking about a vaccine, it's a little bit different insofar as, I'm sorry, bear with me for a second. So here, let's just back up a step. You get this vaccine, it causes this protein to be made in your body. It turns on your immune system. The actual vaccine doesn't stay in your body for very long, but it turns on your immune system to get ready to fight. And your immune system then continues to build up and get ready for a future invasion. And that process takes several weeks, first off, okay? But when your immune system is revved up, it typically causes certain symptoms. And so symptoms that all of us, in this session have experienced many times in our life. And so when we talk about side effects of a vaccine, this one in particular, most of the side effects that we're going to discuss are really your body's immune system being activated. And so as a consequence, they're referred to as reactive or reactogenic side effects as compared to like an allergic reaction or something like that, okay? And so as a consequence, it turns out that because younger people generally have more robust immune systems, that people under 55 actually have a slightly higher likelihood of developing certain symptoms after the vaccine, because their immune system is, is pretty revved up to begin with. And then after you get your second dose, you're slightly more likely to have similar symptoms as well, because your immune system has already been primed to attack. So as a consequence, if you haven't been vaccinated and you get the shot and you develop a fever or muscle aches or feel tired, those are signs that your immune system is working very well. And even though it may be unpleasant, you should take some comfort in knowing that your body's responding appropriately and that you actually did get the vaccine. In terms of serious side effects that are potentially harmful, there have been a small number of people who've had severe allergic reactions, so-called anaphylaxis. That's true for all vaccines. I mean, in most vaccines that occurs at a rate of about 1 in 1.5 million. But in the case of this vaccine, it's not really known how common it is. It's anywhere from, based on the number of people who've been vaccinated, probably anywhere between 1 in 100,000 or 1 in 500 or 1,000 or a million. So it's a very rare side effect, and most of the people who get that are people who are allergic to so many things that they have to carry EpiPens around with them, not just carry them around, but have to use them not infrequently. So it's extremely unlikely for somebody who has no history of allergies to have an allergy to this. Now, other vaccines in the past were the ones particularly that involved the use of live or weakened viruses, like previously influenza vaccines. they had to grow. Part of the process of manufacture involved growing virus in chicken eggs, or and so as a consequence, people who have an egg allergy were told you should be careful about certain vaccines. This is not a live virus, and it doesn't involve any virus at all, and it doesn't involve chickens in any way, shape, or form. So you don't need to worry about a chicken allergy or an egg allergy with this particular vaccine. The CDC has some very specific guidance on this, and basically what they have said unequivocally is, even if you have a food allergy, even if you have a medication allergy, you should still take this vaccine, unless you have a history of a severe reaction to any of the components of the vaccine. There's an ingredient referred to as PEG, polyethylene glycol, which most people are never exposed to, and therefore are not allergic, but it's sometimes involved in certain other arcane, medical things. So that's what they're looking at as a possible link for the few number of people that have had an allergic reaction. And I have a food allergy, and I got the vaccine, and I would this is a vaccine that almost everybody should get, quite frankly, with rare exceptions. And it is true that older people may, if they develop even a minor side effect, might be more affected by it. And so that's something we have to be cautious about. I personally have had patients up to and over age 100 get the vaccine, and I haven't observed, it's a small sample, but I haven't observed any. I can just give you my personal anecdotal experience has been extremely positive with my patients as well. It's estimated that 95% of all residents of long-term care will get the vaccine, because these are people who remember the polio epidemics and things like that, and they have historically taken vaccines. So here you have a group of people that really wants this vaccine, and our challenge is to make sure they get it, and they get it quickly.
Thanks, Dr. Evans. And on that point, I think in addition to people who have a history of anaphylactic shock, the only other groups that have been sort of singled out as not being candidates for the vaccine, I think, are pregnant women and people under 16. Is that right?
Let me just clarify that slightly. And by the way, in these studies, they studied people as young as age 12, but the FDA specifically said we don't want to authorize it for anybody younger than 16, because we want to see additional studies in younger people. Now, with regard to pregnant women, here's the thing, and this is a challenge for people like me and for many of you. Every time a new drug or a new vaccine comes along, the first thing I look at is, okay, in making a decision about whether a particular person should get this, were people like me or whoever the decision is who's been confronted by the decision, were people like me included in the study? Do the results apply to me? And while they included a very diverse population, ethnically diverse by age and gender, they intentionally excluded women who were pregnant before the vaccine. The reason for that is that in the midst of because they routinely exclude pregnant women from lots of studies out of both liability concerns as well as just to keep things simple. I'm not justifying that. I'm just saying that it wasn't unusual. And because they didn't include women who were pregnant, they did not issue any specific guidance one way or the other for that. But and as a consequence of that, so here's the problem. Women who get COVID when they're pregnant first of all, being pregnant increases your risk of getting seriously ill from COVID and dying. And women who get pregnant have more complicated pregnancies on average, and especially a risk of preterm labor and premature babies. And so there is a risk to both mother and child in getting COVID. And as a consequence, organizations like the American College of Obstetrics and Gynecology has weighed in heavily in this to say that pregnancy itself is a risk factor for bad outcomes from COVID, and therefore we don't want women who are pregnant to be excluded from the opportunity to get the vaccine. We recommend that women who are pregnant or who are considering being pregnant get the vaccine only after consultation with or that they consult with the doctor or others who are managing their pregnancy. And they generally recommend that if you're considering pregnancy, get the vaccine first, because then it'll be a safer pregnancy. There is no risk of infertility. In fact, even though women were pregnancy tested before they entered the study, many women after they got the vaccine became pregnant. Now, so there's an association between pregnancy and getting the vaccine, but I don't believe that that the vaccine causes pregnancy. And so just because there's an association doesn't mean it's a cause and effect.
That all makes good sense, Doctor. And I think an important sort of anticipation that people have about getting the vaccine is that in addition to preventing them from becoming ill with COVID-19 disease, they also think that once they are fully vaccinated, they will be able to have visitors. They will be able to no longer socially distance and maybe not wear masks. What, if anything, do we know about how the vaccines help prevent transmission of the virus in addition to preventing illness?
Yeah, I mean, they didn't, with these two vaccines, they didn't study it specifically in their clinical trials, but another vaccine that's in development that's already in use in other parts of the world, the AstraZeneca Oxford vaccine, did study that, and there was no transmission. There was no people who had the vaccine didn't develop asymptomatic infection, and they didn't spread it to anybody else. So there's strong evidence overall, but for these specific vaccines, the answer is still a few months away, probably. Now, having said that, the strongest evidence is that if you get a vaccine, it protects you. And if you're in a particular environment or household or community or nursing home or wherever, and everybody's been vaccinated, then of course, why should we? At a certain point, all of these kind of restrictions are needless and can go away. However, there's going to be a period of transition between when everybody's gotten the vaccine, between when nobody's gotten the vaccine and everybody's gotten the vaccine, and also, but just for what it's worth, if you get the vaccine, your risk of getting COVID is reduced by about 20-fold. Okay, so it's a substantial reduction, but it's not zero. I can tell you that nursing home chains and assisted living chains are very eager to get to the point where they can eliminate these restrictions, but they're also most of these restrictions are imposed by state and federal government, and so and the state and federal government is not going to be quick to pull the trigger on that. When they change their guidance, it will probably be based on vaccination rates of both residents and staff. And there's so much concern in the long-term care industry about low vaccination rates among staff that a number of large chains are already announcing that they're going to make vaccination mandatory for all their staff. So, I haven't heard of any state that's doing that now. I'm sure some legislation will be offered about that, but the market, if you will, is heading in that direction, because not only are they worried about the workforce, they're worried about people not wanting to move into a place where no one's been vaccinated, or none of their staff, because it seems unsafe. And they're also worried about the cost of insuring people who refuse to get the vaccine, and the cost of malpractice insurance in an environment where rates of vaccination are low. So there's a tremendous market pressures at work currently to try to strongly encourage organizations to be highly vaccinated, but that hasn't necessarily translated into people, healthcare workers getting vaccination rates in a way comparable to residents.
Right.
And I should say, vaccination rates among healthcare workers, unfortunately, are historically lousy, not just with this vaccine. Approximately 50% of nurses, for example, get flu vaccines, and the more education people have, oftentimes, ironically, the lower the rates of participation.
Okay, so before we turn to a question and answer period, because we wanted to leave plenty of time to that, Doctor, can you offer any guidance on where people can go online for resources to look at other information about safety and efficacy and side effects? Would you go to the CDC? Would you go to state websites?
Yeah, the CDC is usually my first stop in terms of information about vaccines. They have there's a lot of information. It's hard to navigate sometimes, but a lot of it is really geared toward consumers. But in addition, if you have a specific concern related to a condition, a medical condition like MS or a chronic condition, there are not-for-profit organizations that are that exist to help consumers, help patients with that condition. And so, for example, there's a MS Society. If you just Google MS and COVID, a COVID vaccine, you'll get directed there. Or the American Academy of Neurology, if you have other neurologic conditions. And so there, because a lot of people are concerned, well, I have this autoimmune condition, is it going to get worse from the vaccine? And the short answer is it is strongly recommended that you get the vaccine because you're at greater risk of serious illness or complications. But I don't want you. I'm summarizing other recommendations, but there's a lot of things that are targeted towards specific illnesses. The difference between this vaccine and any other vaccine isn't so much the vaccine, it's the circumstance. The circumstance is that, if you don't get the flu shot, you're still probably not going to get the flu, but you're far more likely to get COVID if you don't get the COVID vaccine. And COVID is far more contagious and it's far more lethal.
Right. And just for people who are interested in more information on the very hairy subject of vaccine scheduling, especially once we get beyond that 1A category, the state is not going to be super helpful about exact dates when people will be able to get vaccines, because most of that is being coordinated via county departments of public health. Often it's most likely also going to involve healthcare or insurance providers, healthcare providers. This new round that will be made available for people over than 65, I think the anticipation is that Medicare data will be used to reach out to people. But this is a work in progress. And so if you're looking for information on scheduling and you're in a facility, talk to your facility administrator. Also talk, if you can, to the County Department of Public Health, and everybody else to just sort of stay tuned as things develop. I want to get to some questions. We've gotten a lot before this program today, and we're getting lots more in the chat. And one really critical one that I'd love for you to weigh in on, Dr. KJ, you too, in terms of your experience, and Tony Chicotel is sort of our resident expert on this, is these complicated issues around consent. Because of course, in a long-term care environment, you have, a whole spectrum of people in terms of their cognitive ability. You have people who are easily able to make healthcare decisions for themselves. You have people who have conservators. You have people who have durable powers of attorney for healthcare. You have people who have none of those things, but may lack capacity and may lack family there to help out with decision making. So can you maybe walk us through some of what you know? And Kay just mentioned this a little bit, but I'd be curious to hear a little more about how she's handled it.
Did you want me to take that, or was that?
Yeah, why don't you take that first, Dr. Evans?
Sure. Okay. Well, one of the fundamental precepts of any kind of medical care is this concept of informed consent, which is that you deserve to, you have the right to make decisions on your own behalf. If you lack that capacity, then someone else that is close to you may have that right, either because you gave it to them as part of an advance directive or because they're your next of kin or something like that. And so, you deserve to know everything about your health, and you deserve to know about any treatment that's being suggested and what the alternatives are and so forth. That often gets short shrift in medicine, unfortunately. And in addition to that, there's also the problem of what I call authentic informed consent, which is the person who's asking you may not actually even have the facts to share with you. So, but having said that, in this particular case, certain traditions have been sort of, I won't say swept aside completely, but for example, a doctor's order is not required to get a vaccine, even if you're reside in a long-term care setting. And the process of consent is it varies somewhat depending on the complexity of things. Like if you were going to have a surgery, they would probably make you even sign a form acknowledging that you were informed of all the risks and benefits. Basically, what's happening here is that in the long-term care setting, the pharmacies have a form that they want everybody to complete, and they don't care who completes it. They just want it completed before they get the vaccine. Now, I can tell you that this is a very vulnerable population, and whether or not people who are able to consent or not is highly dependent on the information and the attitude of the person giving them that information. So that is an issue, and I've seen situations where an executive director doesn't believe in vaccines or something, and then the number of people who actually sign up is very small. and vice versa, and so, one person can make a huge positive or negative difference in this regard. There's the problem of people who can't give consent on their own. They lack that capacity, but there's no one else to do that for them. And in general terms, the goal is always to try to do the right thing on that person's behalf, but it's hard to know what they would consider is right for them if they can't tell us. And so sometimes we fall back on this concept of the best interest, doing what would be in a person's, what someone else believes would be the right thing to do for that person based on the likelihood of the risk and benefit and so forth. And so, jumping ahead a little bit, it is, the FDA and others have stated that the CDC in particular has stated that they believe it's in the best interest of almost everybody to get this vaccine. And so my bigger, I'm very concerned about people having things done to them without their knowledge or consent. But but in the world that I live in, I'm also very concerned about people getting what they're entitled to, whether it's a shower or food or whatever, or access to care. So so there's the two aspects of it really are making sure people get what, have someone else is giving them the power to get what they want, but also trying to navigate situations where it's not really possible to know exactly what they want. And even if people have limited capacity, no means no, basically, in my world, and so, I don't ever want to do something over the objection of a patient of mine. I don't ever want to be on the wrong side of a patient. I work for them.
Right. And I was really struck by KJ's account of Chaparral efforts to get people with limited cognitive ability to information so that they can try to help communicate their own desires. KJ, can you tell us a little bit about what that process looks like, how you try to communicate with them, what you say?
Most of it's because we know our residents. So we have two ladies in particular that I think are good examples. And both of them have dementia and what would be considered pleasantly confused. They have no real idea what's going on. And in the moment, when you talk to them, they make perfect sense. And the longer you talk to them, the less things are tied together. Like every day when I walk in with my mask, they say, "Hello, doctor." And I pull my mask and, "Oh, it's you. Why do you have a mask on?" "Well, there's a virus outside." "Oh, is it outside or in here?" "Well, it's in the news and it's going around." So we kind of tailor what they're saying in the moment. And we can tell by what they're asking how much they can process. It would do me no good at all to go on about the immune system to someone who wants to know why I'm wearing a mask. So, we deal with it that way. So when it came to vaccines, we're all getting excited about our vaccine day tomorrow. And we're going to come in, and the pharmacy is going to come and give us all shots, and the staff and you guys, and why are we getting shots? And so we dealt with it in the moment. And so the next day we had to go through it again. And when the pharmacist went to their room, it was again. And the next day they were asking again. So it's just a matter of meeting them where they are and giving them the information they need. Now we had more robust conversations with their family members. And one of those two ladies can read. So she had a packet of papers she carried around with her for a week and a half that she could point to the vaccine every time the conversation came up. "Oh, you mean this?" "Yes, ma'am, that's exactly what I mean. And see where it says this? That's what we're going to do tomorrow." So, we kept going on about the same thing over and over again, and they kind of took it. Many of our folks that have advanced dementia, beyond yes or no, they're not getting engaged. And so they didn't really have too much to say about it, except those two that were fiercely no matter what for the shot. And so I know that one of them, once her son comes in and holds her hand and fusses with her, she will let the pharmacist give the shot when her son's sitting next to her. The other one, maybe not. But again, those kind of numbers I'm not so worried about. But we met them where they were. Some had the paper to carry around because they were happy for it. And some just asked the same question 1,100 times, and you give 1,100 times the same answer, and eventually they either catch on or they don't.
Right. That's super helpful, KJ. And another question that we're getting a lot is how effective it is just to get one dose. And if you have to get two, how residents and I guess healthcare workers can ensure that they get the second, especially given now apparently the effort on the incoming Biden administration to release all the doses sort of simultaneously, hoping that the second doses will become available. Dr. Evans, you want to address that?
Yeah. Well, early on, because it's a 2-dose regimen, when a dose was released for one person, they held a second dose in reserve to make sure that that person would get both doses. At a certain point in time, this resulted in a lot of vaccine apparently being out there, but not having been used yet. And there was a lot of criticism about it. And so the Biden administration announced that they would release those immediately as soon as they took their oaths of office. And so then the Secretary of Health and Human Services says, well, we'll do it first. And then it turned out actually today that there wasn't any big stockpile, unfortunately, that somehow or another. But having said that, here's the fundamental issue. The fundamental issue is that there's a shortage of vaccine. There hasn't been enough vaccine manufactured to give everybody who wants a vaccine in this country a vaccine, or in the world a vaccine yet. But the problem that's probably more pressing at the moment is not the supply of vaccine today, because there's still a lot of vaccine out there that hasn't been administered. It's because of all the things that were discussed, that there really there's no public health infrastructure to do this. There used to be. It was basically eliminated through lack of funding. And in addition to that, you saw an administration that really wanted to shift the burden of everything related to this pandemic, whether it was testing or PPE or anything else, onto the private sector, which resulted in a lot of chaos and states competing with other states and so forth. So there's a huge problem with distribution. Now, let me add to that, in long-term care specifically. So the federal government said, well, we're going to outsource this to these big companies because they know all about vaccines, because they give out vaccinations all the time. Well, it's true they know about vaccinations. They just don't know anything about long-term care. Okay. And so, for example, and in addition to that, these companies are very decentralized. So they basically just farmed everything out to the local retail pharmacist. Okay. And as a consequence, there's no communication between, you can't just talk to the company and get, and plan for how your 3 different facilities are going to get their vaccines. It's very fragmented. And to add to that, so because the way that they vaccinate people on a normal day is that people come to a CVS and they say, I want a vaccine. Okay, well, fill out this form. And they ask them a whole bunch of questions. It's one form for any vaccine. It doesn't matter which one. And some of these questions are very personal that you wouldn't want to share with people like your employer, like, do you have HIV or do you have cancer or something like that? And so, but you're not sharing it with your employer. You're just giving it to the pharmacist who's putting it away in some file that no one else will ever see. So what they did is, because they have this, because they feel like this has been a previous experience, they said, well, we're going to do what we always do. We're just going to do it in a nursing home. And now they're asking nursing homes to ask employees questions about, do you have HIV? You're asking them basically illegal questions about, do you have a disability? Okay. And so the federal government, the EEOC, issued a statement about this, basically saying that employers can't ask people those questions. But I'm just trying to, and most employers don't want to ask those questions. I'm just pointing out that there's a lack of expertise in long-term care at all levels of healthcare. Most doctors don't know anything about long-term care. Most people are trained in other settings. And when people are trying to make healthcare policy or put together programs, they're thinking about hospitals and they're thinking about clinics, and that's it, because that's all they've ever personally experienced, or because that's all who's invited to the table. And so, but having said that, this whole program was based on an understanding that there wasn't a workforce and there wasn't the capacity, like with cold storage and so forth, for nursing facilities to administer, and assisted living, especially RCFEs, to deliver the vaccines themselves. And so they said, well, if we want it done, we're going to have to bring somebody there to do it. Now, the catch is that you've got 2 chances to get the first dose, and if you miss that, even if you really want the vaccine, but you miss it because of some health issue or whatever, then you may not be able to get a vaccine ever again unless you go to some other setting, until the day comes that different vaccines are available that don't have the same storage requirements and that are more widely available. But not until the shortage is done and everybody gets a chance will people who miss their shot, get a second chance at getting a shot.
That's very helpful, Doctor. And one thing that we're hearing from the state is that they are considering trying to get general acute hospitals to vaccinate people who are going back to skilled nursing facilities or assisted living facilities. So at least while they're at the hospital, they can get that first dose and hopefully arrange for the second dose as well. Just really quickly though, Doctor, and we're running out of time.
Sure.
Can you just give us 30 seconds on why we should be optimistic about the new Johnson & Johnson vaccine, which is hopefully coming online soon?
Yes, this vaccine, well, it's a very traditional vaccine, so it's expected to be effective. And there's some preliminary data that show they haven't finished their big study. But the data that's out there so far is very encouraging. And the thing about this vaccine is that it can be stored in a refrigerator, and so forth. So it's much more easy. It's easier to transport. It's a vaccine that could easily be administered by by nurses. The challenge with RCSFEs is there aren't nurses there all the time, but it's something that could easily be administered without having to worry about all these restrictions, and it only requires one dose. Hopefully, they're studying whether one dose is sufficient, but so far so good, and that means you can vaccinate a lot more people quickly because it's half as many doses. So people should know that the production of these vaccines is increasing rapidly. Additional vaccines are coming online. And so there is a way out. This is our way out, is through vaccination. And I have much more confidence in the incoming administration because they have a lot of experienced people that have been named that that people who want to get a vaccine will be able to get a vaccine fairly soon.
Great.
And I'm very confident about that.
Thanks so much, Doctor. And thanks to both you and to KJ for your insights. We really appreciate having both of you on our program today. I want to remind everyone that if you have outstanding questions which haven't gotten answered, do just email them to us. And importantly, for those who are in long-term care facilities or who have family there, and if you're hearing that they're not offering the vaccine or they're not scheduling vaccination dates, that is something we would like to hear about, especially smaller assisted living facilities. Thanks so much for participating, and good luck to us all in the next few months.
Thank you. If I could just say in closing, thank you very much for having me. And to everybody who's on the call, if you're on this call, it's because you're somebody that really cares about other human beings. And so I just want to say thank you for caring. Thank you for being the person that you are, and never underestimate the difference that you make in the world. Thank you.